which is a French and a small company based in Lille in the north of France. Okay. His CEO, his chief executive officer is Fabien Pagnet. And in fact, this company was born in a garage. And I'm really passionate on working in this company because this company is helping to expand a very interesting concept, which is as well expanding in other areas of the healthcare. But today we're going to talk about the NIPE technology, which is a heart rate variability analysis in order to help clinicians to assess which is the autonomous nervous system of the neonates in real time. And we are going to use it especially in order to take care of pain while the patient is during his stay in the hospital in the NICU. But as well, it can be used, of course, in order to titrate the analgesics during the surgery. In any case, it's well known and it's an increasing problem. The amount of preterm babies born in the world is really increasing. 1 in 10 of the babies born are a preterm baby. And this is something that is really important because preterm babies are going to have special healthcare conditions that are going to affect later on to his development, to his physical and neurocognitive development. It's well known, of course, that preterm babies are more likely to have diabetes type 1 or type 2 compared to the normal term babies. As well, it's known that the possibility of having cardiometabolic diseases increases much more in those preterm babies, and especially in those with low weight, than those that are born on the right time or with a better weight. It's not only going to affect to the dysglycemia that they may have, but as well to his body mass, fat, to the amount of fat that these babies will have when they will grow, but as well to the lean mass that they will have, and that has obviously direct correlation with cardiometabolic health and with cardiac problems later on when they are young adults. It is as well very well known that these babies may have as well more likely conduct of alcoholism, for instance, of drug abuse. The risk is in a normal baby that they will be alcoholic when they will grow and they will get adult. It's nearly a 4%, when in this kind of babies it's nearly a 14%. The mechanism why this may happen, there are several theories about it, but it seems that the alcohol may produce any kind of damage on the brainstem, on the reward nucleus, which is the nuclei accumbens, or as well there is another theory, probably are both together, that there will be some epigenetic changes and mechanisms that will trigger an increase of stress hormones in these babies, and that kind of stress hormones will affect later on to the reward center, and obviously alcohol, it's some kind of reward, the same as fat and glucose. So it has been said, and it's known, and there are several publications already talking about the importance of the first 1,000 days since conception. It seems that the autonomous nervous system, which is the one that is going to manage the energy and the life of that being, is going to be set up during those 1,000 days. So any factor that will occur in the belly of the mom and afterwards until the baby gets 2 years of age will affect directly to his capacity of being healthy when he will be adult, or the amount of diseases that they will have. This is what is called epigenetic programming. And obviously, for instance, this study that I show you below, the epigenetic programming by maternal behavior, is showing, for instance, in puppies, that those puppies that has been linked by the mom, they will have a much more stable character with less cortisol and stress hormones release, and less aggressive response than those who didn't have that amount of linking by the moms. This has been proved as well with historical analysis in human beings. So it is really important to control the stress in these neonates, because as I said, it will have an effect on the long-term outcomes later on. But obviously, that stress may have a direct effect in mortality as well, and especially in babies going through surgery. This publication that was published in 1992 in the New England Journal of Medicine was really saying exactly this thing. What they did was in cardiac patients that were going to go through a cardiac surgery, in neonates specifically, they were comparing two groups of anesthesia delivery. One was going to be just with halothane and morphine, so very low doses of analgesics, and the other one was with high doses of sulfentanyl. So at the beginning, the normal practice was just giving halothane and a small amount of morphine, because they were thinking that the neurodevelopment of the babies were not sufficient in order to allow them just to feel pain, right? So these doctors want to treat if the babies will improve their outcomes when that analgesia was provided or was not. The most important result was that the mortality ratio in the babies with high doses of sulfentanyl was 0 in 30, when the mortality ratio in the group of halothane was 4 in 15. So babies were treated with analgesics were surviving more than the ones that weren't. So what they did was to look at the amount of cortisol, glucagon, and noradrenaline that these babies were releasing, and they show that the babies treated with sulfentanyl had a much lower stress profile than those that were just given halothane. And when you see the cause of death, you may see as well that sepsis and SID were the main reasons of dying, which are directly related, obviously, to that stress response. So stress is a major problem and is what we need to treat. And in order to treat it, we need to control it. And obviously, in order to control it, we have to measure it. So what happens is that any stressor will provoke a disbalance in my autonomous nervous system homeostasis, and it's going to increase the sympathetic response, provoking what it's called surgical stress in the case of the surgery, right? Or any physiological stress that is going to activate the immunitary system, provoking a release of cytokines like interleukin-6 or necrosis factor tumoral, prostaglandin E, etc., all of them, which will increase the level of inflammation of the body, provoking later on damages in the different organs that may lead to death. In order to control that, the parasympathetic system will be activated as well, trying to maintain that allostasis, that equilibrium, releasing certain cytokines that will provoke anti-inflammation. But if that is not balanced, we may have as well some problems like infection, sepsis, multi-organic failure, and death. So this process, we need to have it in mind, because this is the reason why we are going to have problems in babies, especially in those that are setting up their autonomous nervous system during those 1,000 days, because that autonomous nervous system will be set up in a way in which will respond to the environment in which he's going to live. So if the mom is suffering a lot of stress, the baby may learn, while the baby's in the belly, the baby may learn that he's going to be born in an environment with a lot of stressors. So his body is preparing himself, enhancing a lot of the sympathetic activity, which will lead later on to chronic inflammation with all those problems that we saw before. The same will happen when the baby is born. So we need to control very much, which is the stressors that the baby is suffering when they are in the NICU or in other environment until the 2 years of age. So it's well known that babies, when they are born, especially preterm babies, are lacking parasympathetic activity, are lacking, in fact, heart rate variability, which is the way in which we can see which is the power of the autonomous nervous system. And we will discover later on the principles of that heart rate variability. But in any case, it's known that in neonates and especially preterm babies has a lack of parasympathetic activity, a lack of anti-inflammation, a lack of well-being, if you want, and that will be developed through the time. This is the reason why the NIPE process, which you all may know, it's implemented in the NICUs, because it is very important that we really promote the parasympathetic activity of those babies in order to maintain that allostasis that we were seeing in the previous slide. So it's important to reduce the maternal depression and to maintain the mom while the baby is in the belly in a very nice conditions. Obviously, feeding is really important as well, and the massage, the skin-to-skin contact, cocooning, etc., in order to promote that parasympathetic, that well-being, and that inflammation, avoiding all the other problems that we may have. But in the EpiPain study, it was demonstrated that the babies that goes to NICU, they receive from 15 to 20 surgical stimulations or any procedural stimulations that will increase, obviously, the sympathetic activity of the baby. So we need to be very careful with the amount of stimulations that we are doing, because then we are enhancing that sympathetic activation. Or if we have to do it, then we need to be very sure that we are coping with those stressors and very well, treating them with the right analgesics and in the right time, in order to be able to increase that parasympathetic tone and maintain that balance. So procedures like the heel stick, catheters, aspirations, etc., need to be really treated in order to maintain the lower possible sympathetic activations in those babies. And the way to assess that level of stimulation, obviously, are the scales. In fact, the gold standard is the own person. I mean, if you want to know how much pain I'm suffering, the best thing to do is to ask me. But the problem is with those babies that cannot communicate. Obviously, preterms and neonates cannot communicate. So we need to look for surrogates characteristics in the babies that will tell us how much they are suffering. And that will be obviously the face expression. And we have different scales, like the, well, you know all of them, no? Edding scale or flag scale, etc., in which we will be able to see more or less which is the level of pain or suffering that the patient is having. The problem is that the neonates doesn't behave as adults, so there may be some confounding factors as well. There are some studies already proving that depending on the observer, we are going to obtain different grades of what we will call the sympathetic activation or suffering in those babies. So we need to look for an objective measure that will tell us which is that balance between the sympathetic and the parasympathetic, because this is the main reason. This is the main reason of all those problems that we saw before. So since the 60s, heart rate variability analysis has been used in order to assess the autonomous nervous system. The heart rate variability process occurs in all mammals, and what happens is that the R to R distance are not constantly the same. those distances may vary depending on the activity of the parasympathetic and the sympathetic activity mediated through the nucleoaccumbens and the ambiguous. And measuring that heart rate variability, and that process we are going to see it now, we will be able to assess that autonomous nervous system. This is what the NIPE monitor is doing for you constantly during all the stay of the baby in the ICU. So you will be able to see what is happening with the parasympathetic system in your baby and to be able to take more objective decisions. So heart rate variability may be considered a fit vital sign because it is managing, or it is the heart rate variability is managed by the autonomous nervous system, as I said, and the autonomous nervous system is the system that is managing life. It's the system that has the objective of maintain the being alive in a way, to manage that energy in order that we will survive in our environment. And the theory is that it was developed when mammals were still in low O2 environments, because O2 is what we used in order to produce energy with the glucose, right? So in order in multicellular beings, obviously we need a pump in order to collect that oxygen and send it to the rest of the cells, and that pump is going to expend energy as well. So if we are expending energy in order to collect O2, in order to produce energy, we need to be very sure that the system is efficient expending that amount of energy. Because if we expend more than what we are going to get, then the being will collapse and will die, right? So the nucleoaccumbens and ambiguous, which are two nuclei that are on the deep brain, I would say. Okay, there is one in the brain, in the stem, and there is another one very nearly the amygdala, the accumbens, which, by the way, the nucleoaccumbens is considered the reward center, and it's very interesting how this reward and pain concept it's there in order to attract you to the things that are good or are making you feeling better, right? That's the reward. Or the pain one is the one that will put you away from those things that may damage you, no? And it's very interesting how these two nuclei are as well linked to this heart rate variability. So what we are going to do, these two nuclei, through the information that is going to receive from the stretch receptors in the terminal bronchus through the vagus nerve, are going to make that the heart beats faster when I have more oxygen in the lungs, and beats slower when I don't have that much oxygen in the lungs. No, so in expiration, the vagus nerve is activated, so the parasympathetic system is activated, and the heart rate will decrease in a way. The distance between R2R will increase, and in inspiration, it's the other way around, and the distance are going to decrease in order to send more blood to the lungs and get that oxygen in order to be sent to the rest of the organism. So we are going to measure this thing in order to see which is the play between the sympathetic and the parasympathetic all the time. And we will see in real time if the parasympathetic is higher or lower in the well-being, in the being that I am analyzing. So I'm going to measure those distance between R2R that I told you that are increasing and decreasing through the time. And I'm going to draw a tachogram that will express, if I put those signals in an axis, I will see that those distance will increase in aspiration and will decrease in inspiration. So I will obtain a tachogram, a wave, that in fact is like the EEG of my nucleoaccumbens and ambiguous. And analyzing this signal through fast wave-length transform, which is what the NIPE monitor does, I will be able to see the spectrum of frequencies that are composing that signal. It's the same thing that happens when the light goes through a prisma and I see the rainbow. We're going to do exactly the same thing. And we are going to obtain three kinds of bands. the very low frequency, the low frequency, and the high frequency. The very low frequency is related to thermoregulation and the corticotrope axis activity, so hormones activity. The low frequency is much more related to sympathetic activation, and the HF is related mainly to parasympathetic. So what we are going to do is to filter out those HF bands, and we're going to pass it again on reverse through fast wave transform, and we will obtain a curve that is representing the parasympathetic activity of the patient in real time. And we are going to calculate the area under the curve of that, and we are going to obtain a number, which is the NIPE. The NIPE instantaneous or the NIPE media, in fact, is the percentage of parasympathetic activity that we had in the last 2 minutes if we are talking about the NIPE instantaneous, or in the last 20 minutes if we are talking about the NIPE media. So the NIPE media is much more comfort analysis or a comfort measure of the patient because it's a very long term analysis, so it will help the clinicians or the nurses to see which is the trend of that baby, if he is under chronic stress or a lot of discomfort, or if the baby is in comfort, right? And the NIPE one, the instantaneous one, is the one that I will use in order to assess the different painful procedures that may occur during his stay in the NICU, or I will use this one in order to titrate the analgesics during an operation in the OR. I will be able to see as well the ECG wave in the screen of the monitor, so I'm able to see that I am really measuring the ECG and the R2R distance, okay? Because obviously what we need to have is a good R2R distance. There are several studies proving already that this technology is much more able to detect the noxious stimulus than other parameters that may be available. Mainly, we use heart rate and blood pressure. The increasing 20% of heart rate or blood pressure is known as a good indicator, right, of analgesia. This study was what they were doing was to make a tetanic stimulation to the patient and to see the relationship of the change in that parameter. And we may see that the ENI, which is the red color, is very much related with an area under the curve of 0.98, that heart rate and blood pressure. Heart rate and blood pressure are able to detect it on a 75% of the cases. But the most interesting thing is that when I add opioids to the equation, heart rate and blood pressure are not anymore able to detect or to discriminate when there is a noxious stimulation, when the ENI or the NIPE monitor is able to detect it in the majority of the cases. So one of the first lessons is that heart rate variability and the ANI or NIPE parameter are much more able to hemodynamics to detect noxious stimulation. So the next time that you see a NIPE falling down, but a heart rate stable, you may give extra analgesics in order to improve that stress that is occurring in the baby, instead of making confidence on the heart rate and blood pressure, because they are not able to detect only 50% of the cases of that nociception. And in that way, you will improve his balance, his allostasis balance of his autonomous nervous system. This study that has been published very recently by Dr. Wallace in Poland in his NICU was as well showing something very similar than the previous study, in which it's an observational study made on awake neonates in this case. And he was able to demonstrate that when you make a no or mild pain stimulation, or a moderate pain stimulation, or a severe pain stimulation, the index was reflecting that intensity of stimulation. So it was very, very precise in order to tell you when the baby is having a severe pain, or a moderate, or a mild intensity pain. This other study was performed during anesthesia. The previous one was in the ICU, and this one is performed in the OR in neonates under severe anesthesia. And it was just an observational study as well. And what they were showing is that the heart rate was quite stable, while the NIPE was able to show the stimulation of the block. Obviously, you are making a punction, so you will see that drop in the NIPE. And then as well, it was able to see the stimulation of the incision, provoking a drop in the NIPE, while heart rate was not able to show that stimulation, right? So in those two patients, we were able to increase the amount of analgesics, and for instance, it's shown here in this other table. When you make the administration of opioids, you will see the increase of the NIPE value, while the heart rate stay more or less stable or decrease a little bit. Another interesting graph that you can see on this publication is this other one, in which they were adding morphine, and they were seeing that there was no change in the NIPE values because they were just monitoring 120 seconds to 140 seconds, so just 4 minutes or 5 minutes after the injection of morphine. And everybody knows that morphine takes nearly 20 minutes to make effect. So another lesson that we can learn from here is that NIPE can tell you exactly when the effect of the analgesic drug that you are giving is making effect. Okay, so for fentanyl, we need to wait 2 minutes. For remifentanil, 1 minute is enough. Well, surfentanil maybe 5 minutes, etc. And the same study was replicated later on in pediatrics over 2 years of age with ANI monitor, and it's the same group. No, they made the same kind of analysis. So we demonstrate in the neonates and we demonstrated in pediatrics that NIPE is able to detect much better than heart rate the noxious stimulation. Another way of showing that is this study made by a French group in which they were administering a tetanic stimulation at different remifentanil concentrations, and they were seeing how that difference between the pre-stimulation and the post-stimulation was increasing due to the decrease in the amount of remifentanil that they were giving. So at the same kind of stimulation but lower dosification of remifentanil, obviously the delta in the change of the NIPE pre-stimulation and post-stimulation was increasing. So NIPE can be used in order to titrate the level of analgesia depending on the intensity of the stimulation that you're having in your patient. This is just a case in which we show how important is to administer the glucose in the right moment. This is a baby that went through a pre-heal process, so we give him before the sucrose in order to improve his well-being, right? The problem is that we made the pre-heal much later than the effect of the saccharose, so we lose in a way the effect of saccharose. We should have done much earlier the pre-heal. We should have done it in fact at 10:50, for instance, in order to get advantage of the well-being that the saccharose was producing in the baby, and not having then this decrease in the NIPE due to the pre-heal that we perform into the patient, right? So as we know, in the ICU, it is very important to control of all these sympathetic stimulations that we may have on the patients, right? Because we saw in the EpiPen study nearly 20 stimulations, and that sympathetic reactivity and constant sympathetic reactivity is provoking obviously an increase in cortisol levels, glycemia in the patient that may affect as well to the immunitary system, provoking more cytokines that will affect the different organs, and this may be the cost obviously of diabetes, of obesity, of cardiac problems later on, but as well on comportamental problems, alcoholic, etc. And because of that, the NIPE process is in place, but we need to measure if we are doing it right or we are not. And the best way obviously is to assess the parasympathetic system with the NIPE. So here in this study, we are showing how the NIPE is showing the effect of cocooning. And we were able to demonstrate that it doesn't matter if the cocooning is made by a third person or by the mother. Skin-to-skin contact as well is really important in neonates and in preterm babies, especially because they have this lack of parasympathetic activity, as we said. And in this other study, we are showing how NIPE is able to demonstrate that benefit on the babies, but only in those babies that are, in fact, on an uncomfort state. So those babies with NIPEs below 57 will benefit from skin-to-skin contact. If your baby is already over 60, then you don't need to take him. You might better leave him alone in his incubator, because that baby doesn't need to be annoyed in that case. No. So the index will help you as well to decide when you have to do a process or when you don't need it. Okay. So I already explained that NIPE is a percentage of the parasympathetic activity in comparison with the rest of the activity of the autonomous nervous system. So it's quite easy to understand that we need to be over 50, because that means if the NIPE is on 50, it means that the 50% of the activity of the autonomous nervous system is parasympathetic, so the other 50% will be sympathetic. So if we are over 50, we are much more on the parasympathetic side, which may say that we are on the comfort side, right? So a good value is over 60. It's a nice value, and it's very interesting how the neonates, the preterm babies especially, are born with lower NIPE values because they are on a sympathetic status, and we need really to increase that parasympathetic in order to make that balance in that homeostasis and improve his well-being, right? So as a conclusion, the NIPE monitor is a non-invasive device that doesn't annoy anyone, that will tell you which is the parasympathetic percentage of your baby during his stay in the ICU or in the hospital or wherever. Several studies have already shown a good correlation with the behavioral pain scale, or even better than the pain scales in order to detect nociception. It's better than heart rate and blood pressure in order to detect nociception. It will help you as well in taking the different decisions that you may have in order to improve the well-being of the patients. This is all the information that we have related to the NIPE monitor that has been published and what has been demonstrated. But obviously, NIPE values or ENI values are based on heart rate variability, and they are directly correlated with HF-NU and the energy or the total power. I tell you this because there are a lot of publications already making analysis on heart rate variability and different other health areas. As I told you, the ENI and the NIPE, it's very strong correlated with what is called HF-NU. And the energy value that will appear when you download the data on your NIPE monitor is basically the total power, or the SDNN value that you will read when you talk when in the different publications about heart rate variability in neonates, etc. So, as I told you, there are a lot of publications ongoing about heart rate variability and different processes in health. For instance, there are publications making a relationship between the heart rate variability and different inflammatory markers and survival in sepsis or in hypoxic ischemic patients, encephalopathy, etc. So we very recently have demonstrated in COVID-19 patients that the value of ENI and energy may predict the mortality ratio of those patients. So there is a lot of work in terms of research that can be done as well with an NIPE value. Very recently, and this is a preliminary study that we are conducting with neonates with hypoxic ischemic, we saw that depending on the value of the NIPE, it will tell us which is going to be the prognosis of those babies. Those with higher NIPE values had a more or a worse score than those who has a lower NIPE values, because in terms of sepsis or hypoxic ischemic, etc., it's very important to have a powerful autonomous nervous system and a powerful sympathetic in order to fight against those results. So more or less, this is all what I wanted to tell you about the NIPE index. I hope you enjoyed. And now, if you want, I can respond to the different questions that you may have. Yes. What happened is that as well, the question is, which is the relationship between NIPE and sepsis in newborns and its ability to measure heart rate variability? Well, in fact, there are a lot of studies making a relationship between heart rate variability and sepsis. The link is that the autonomous nervous system is the one that is managing the immunitary system. And heart rate variability is a way to measure this autonomous nervous system activation. The sympathetic activation is the one that is making an increase in leukocytes and as well in cytokines, etc., in order to defend the body against the different bacteria. Okay? So at the beginning in an infection, we will have an increase on the sympathetic side with expense on different catecholamines that will help us to activate all those processes. If that infection persists for a long time, which may happen as well with any stressor, then what happens is that we will have a depletion on the sympathetic activity. The heart rate variability will decrease, so the total power or the energy will decrease, and the percentage of parasympathetic compared to sympathetic will increase because of this depletion of the sympathetic, although the total autonomous nervous system is very low. And this means that you are arriving to the end of the process, which means, unfortunately, to death, right? So there is a lot of publications saying that when you have a very low heart rate variability, your health status is very low. So your probability of being dead in the future, it's higher than when you've got a higher heart rate variability. There is a lot of publications that you may read it deeper, but more or less, I hope that I explained myself rightly in order for you to understand. If not, tell me and I will try to explain it in another more simple way. So the other question, do we have experience with NIPE and DEME? What does it mean, DEME? It doesn't mean dexmedetomidine, maybe? Well, if it's dexmedetomidine is an alpha-2 agonist. An alpha-2 agonist, like noradrenaline, for instance, that will occur in that way, it's a way to cut the sympathetic activation. So it's sympatholytic. So it will free the parasympathetic activation. So you will have an increase on the ANI or in the NIPE values because you have a higher parasympathetic activity in comparison with the sympathetic. So alpha-2 agonists are used, for instance, nowadays in opioid-free anesthesia because in awake patients, pain exists obviously because one of the processes of pain is perception, and you have to be awake in order to perceive pain. But when you're asleep, obviously that part doesn't occur, and what we need to maintain is the balance between the sympathetic and parasympathetic, as we said. And one way of increasing or coping with the sympathetic activation that the surgeon is producing during the surgery is cutting that down, for instance, with alpha-2 agonists like dexmedetomidine, right? Or we can cut it down as well with beta blockers. This is why there are even meta-analyses proving that esmolol, it's a good analgesic, even better than remifentanil, for instance. Now, this is in which it is based opioid-free anesthesia, in balancing the parasympathetic and the sympathetic, promoting the parasympathetic and stopping the sympathetic in that way. As well, it is in what is based the ERAS, the Enhanced Recovery After Surgery programs, in which they try to incentivize the capacity of the autonomous nervous system, just putting the patient 20 days before the surgery to make sports. And why sports enhance the autonomous nervous system? Because making the right amount of sport will increase the sympathetic activation while you're doing that sport, and then with the rest you enhance the parasympathetic, and you are making stronger your autonomous nervous system, and it will be able to cope much better with the different stressors. Is there any study about the relationship of NIPE and developmental state of newborns afterwards? No. NIPE is a very new technology, and still we didn't have the time to make for such a long period. But there is, of course, high variability and this developmental state in the different newborns, and we are high variability, as I showed you before. NIPE index is HF-NU, and the energy value that will appear when you download the data, it's the total power, or the SDNN. May you refresh me in which case has to be very careful to not to provoke alcoholism on any future problems to the newborns? Yeah, well, the different studies have proved that when you have babies that has suffered in the first 1,000 days, that has a lot of sympathetic activations with higher levels of cortisols, etc. So, for instance, problems, moms that has had depression during his pregnancy, or even that has had a physical problem with the placenta, in which the permeability of the placenta has led to an increased amount of cortisol passing to the fetus, for instance, or those babies that have not have the right environment during those 2 years of age, and that has had that increase on stress. And this is the hypothesis, that those higher stress levels and cortisols will provoke like epigenetic changes in the patient that will change the activity of the reward center. Then what it has been proven is the relationship between preterm babies with this kind of problems that I've already told you, and an increase of alcoholism when they grow. And in order to explain this link, probably the theory it's about the amount of stress that the patient is coping with, his autonomous nervous system is coping with. There are clinical cases, obviously, with nitrous oxide. Nitrous oxide is enhancer of the parasympathetic activity. I've seen that in the OR, in neonates, in pediatrics, and in adults, and you may see an increase in the NIPE value or in the ENI value, just telling you that you are really enhancing that parasympathetic activation. So I might say that nitrous oxide is really a very good analgesic.